Hello everyone, my name is Lindsay Lewis and my group mates, Jeremy, Kathy, and Sandra Jason, we will present the mid-range theory of chronic sorrow. The middle-range theory of chronic sorrow was developed by Dr. Georgine Inks, Dr. Mary Burke, and Dr. Margaret Hainsworth, and it was published in 1998. This theory was developed to provide a framework and a presentation of sorrow as an ordinary reaction to unceasing disparity due to loss. This theory is able to be classified as a mid-range theory because it is more concrete than abstract. It can be applied directly to nursing practice, and it was developed inductively and validated through 10 qualitative studies conducted by Dr. Eakes, Burks, and Hainsworth. Dr. Eakes holds her diploma in nursing, a bachelor's degree in nursing, a master's degree in nursing, and a doctoral degree in education. It was in 1989 when she attended a conference and heard a presentation by Dr. Burke on chronic sorrow that the two instantly formed a connection. Dr. Eakes and Dr. Burks went on to meet with Dr. Hainsworth and Carolyn Linger. This meeting resulted in the formation of the Nursing Consortium of Research on Chronic Sorrow, also known as the NCRCS. Dr. Mary Burke also holds her diploma in nursing, bachelor's degree in nursing, master's degree in nursing, and doctorate in science of nursing. After meeting with Dr. Eakes and Dr. Hainsworth in 1989, Dr. Burke developed a modified Burke NCRS chronic sorrow questionnaire. This study led to the development of the current theory of chronic sorrow. Dr. Burke's work in this series concentrated on chronic sorrow in infertile couples, adult children with chronically ill parents, and bereaved parents. Dr. Margaret Hainsworth holds her diploma in nursing, her master's degree as well, and her doctoral degree is in education administration. She is also a board-certified clinical psychiatric and mental health nurse specialist. Dr. Burke's fascination with chronic illness and sorrow stems from her work with the support of women with multiple sclerosis. Theoretical assertions and propositions. Eakes, Burke, and Hainsworth theoretically asserted that chronic sorrow is an ordinary human reaction to ongoing disparity with the loss. The researchers suggest that the experience is a cycle and proceeds as long as disparity remains. There are intervals of happiness and satisfaction that are mixed with the occasions of re-grief. This prevents the grief from becoming debilitating to that individual. The researchers also assert that disparity results from experiences of loss in which one's present reality is greatly different from the idealized. This persistent disparity commonly leads to chronic sorrow. Internal and external triggers that exacerbate disparity can be categorized and anticipated. Effective learned coping mechanisms and appropriate interventions can possibly help persons experiencing chronic sorrow to recover to their previous emotional equilibrium and attain an increased level of comfort.
Two primary sources were used for this paper. Both of the articles were written primarily by the authors that wrote the chronic sorrow theory. The first one was entitled Mid-Range Theory of Chronic Sorrow. The article was written by Eakes, Burke, and Hainsworth and can be found in the Journal of Nursing Scholarship and was published in 1998. The second article was titled Milestones of Chronic Sorrow, Perspectives of Chronically Ill and Bereaved Persons and Family Caregivers. And this article was written by Burks, Eakes, and Hainsworth and was published in the Journal of Family Nursing in 1999.
Nursing meta-paradigm. The nursing meta-paradigm is conceptualized through this theory's major assumptions. The conceptualization of nursing involves a diagnosis of chronic sorrow and providing interventional and therapeutic nursing care within the scope of practice. Person is conceptualized under the assumption that humans possess an idealized perception of life and health, which they compare their personal experiences with. And despite each person's loss being distinctive, there are recurrent and foreseeable characteristics of lost experiences. For the concept of health, there is an assumed normality of functioning. An environment is conceptualized as the social context in which an individual's interactions occur. Central concepts and definitions. Chronic sorrow is defined as the recurrent, permanent, pervasive sadness related to continuous disparity as a result of an experience of loss. The main antecedent that needs to occur prior to the onset of chronic sorrow is involvement in a significant loss. This loss may be continuous with no foreseeable end, such as the birth of a disabled child, the diagnosis of a chronic illness, or it could be more limited loss like a loved one's death. What may be perceived as a significant loss to one person may very well not be perceived the same way to the next person. Therefore, research has proven that never-ending loss, like a parent's loss of a quote-unquote perfect child, puts an individual at considerable high risk for developing chronic sorrow. The next antecedent to chronic sorrow is unresolved disparity. Disparity results when a loss creates a gap between the desired relationship and the real relationship. This absence of closure sets the stage for grief to be periodic, ongoing, and recurrent. Triggered events are conditions that exacerbate an individual's experience of disparity. Triggers vary from person to person, and they depend on whether the significant loss is associated with having a chronic illness, being a family caregiver, or experiencing a loved one's death. Management methods refer to coping strategies and interventions. Coping strategies utilized by individuals with chronic sorrow are defined as internal management methods, and professional interventions are defined as external management methods. Effectively using coping strategies and interventions can help individuals that are experiencing chronic sorrow regain their emotional equilibrium. They will be able to attain a higher level of comfort and lengthen the period of time between triggered events. The major assumptions of the theory of chronic sorrow are categorized with the concepts of the nursing meta paradigm. Assumptions for nursing include the diagnosis and interventions of chronic sorrow are within the scope of nursing practice, and it is the nurse's responsibility to give anticipatory guidance, maintain an empathetic presence, play a teacher expert role, and be a caring and competent caregiver. Assumptions for person include humans possess an idealized perception of life and health, which they compare their own personal experiences, and despite each person's loss being distinctive, there are recurrent and foreseeable characteristics of loss experiences across the board. Assumptions for health include that there is a regularity of functioning. One's health is reliant upon disparity adaptation, and normal reactions to losses in life are results of effective coping. Lastly, assumptions for the environment include that interactions take place within family, social, work, and healthcare environments, and people react to assessments of themselves relative to the standards that society has set for us. Theoretical assertions and propositions. Eakes, Burke, and Hainsworth theoretically asserted that chronic sorrow is an ordinary human reaction to ongoing disparity with the loss. The researchers suggest that the experience is a cycle and proceeds as long as disparity remains. There are intervals of happiness and satisfaction that are mixed with the occasions of re-grief. This prevents the grief from becoming debilitating to that individual. The researchers also assert that disparity results from experiences of loss in which one's present reality is greatly different from the idealized. This persistent disparity commonly leads to chronic sorrow. Internal and external triggers that exacerbate disparity can be categorized and anticipated. Effective learned coping mechanisms and appropriate interventions can possibly help persons experiencing chronic sorrow to recover to their previous emotional equilibrium and attain an increased level of comfort. Summary of the theory. The middle range theory of chronic sorrow provides us with a framework to guide nurses and other interested parties in understanding an individual's response to loss. The empirical evidence used in the development of this theory was derived from 196 individual interviews with people who have similar experiences with chronic illnesses, family caregivers of chronically ill patients, and bereaved family members. Chronic sorrow explains experiences of people across the lifespan who have encountered prevailing disparity due to significant losses. Nurses need to recognize that chronic sorrow is not an uncommon occurrence, and it is of utmost importance that nurses view the recurring nature of chronic sorrow as a normal reaction to ongoing disparity, and we need to provide the necessary support for these patients.
The schematic concepts for our theory are found on page 666. Chronic sorrow theory and 666 doesn't bode well for us, does it? Also, here's a copy of it right here. Now, what you'll notice is it encompasses a person's entire lifespan. At different points in a person's life, disparity happens, which is shown here, right there in the center. And that can be triggered by a specific episode or a trigger event. And disparity never leaves and can reoccur at any time. Once disparity starts, then the feelings of chronic sorrow begins. Now, sorrow is referred to as chronic due to the fact that it never is truly resolved. The only course of action to treat chronic sorrow is to manage the episodes. Managing efforts are used by internal and external management methods. Internal management method would be maintaining personal interests and using emotional and spiritual coping mechanisms. External management theories external management methods are coping mechanisms provided by healthcare providers such as therapy or therapeutic communication. These management methods are either effective or ineffective and can cause comfort or discomfort, which then can either lead back to the feelings of sorrow will then abate until it's triggered by another episode or event, which really just right back into disparity, which causes the whole cycle to repeat. And this, like I said, this usually happens until the individual involved in this is to pass away. Logical forms. The theorist's main concern was to dispute Olshansky's prior statement that sorrow occurs periodically throughout the life of a chronically ill child. Parents never receive closure concerning their feelings about the child while they are still living. Only after the child's death could parents process their feelings. Now, our theorists, Burke, Eakes, and Hainsworth, presented the assumption that sorrow is a normal response to a child's illness. They even expanded on the theory to include those with chronic illnesses and bereaved individuals that have lost loved ones. This allows the chronic sorrow theory to apply to more groups directly than focusing on one key group. The theorists have defined that the resolution of feelings do not occur at the time of death, but may continue depending on circumstances, such as the anniversary of the loved one's diagnosis or death, and any events that may trigger feelings of disparity.
We'll now talk about the theory of chronic sorrow and its relationship to nursing research, education, and advanced nursing practice. The theory of chronic sorrow has a great impact on the nursing research, nursing education, and advanced nursing practice. Nursing research helps to explain different concepts and give evidence used to guide practice. The theory of chronic sorrow has given other interested theorists a starting point to conduct research. A review of literature found that many articles published related to the theory of chronic sorrow was merely an extension of the work already published by Eakes, Burke, and Hainsworth. Other theorists have extended the work by conducting research on other populations that haven't been explored. Further research is needed to test the theory, create valid instruments to measure chronic sorrow, and explore populations that have yet to be studied. This theory has been developed. Now more research must be done to fully understand the concept of chronic sorrow. Nursing education. The definition of chronic sorrow within the theory and the definition found within the NANDA have been found to be closely related. The NANDA has been used within nursing programs for many years, providing nursing students with the education needed to explore those diagnoses of their patients. The material provided with the NANDA gives each student the knowledge needed to make those difficult decisions when practicing. The theory of chronic sorrow has provided an in-depth look at the concept and knowledge that can be used within the nursing curriculum. The student can grasp a better understanding of the diagnosis of chronic sorrow and use that in the future when they encounter with those individuals affected by the concept. Advanced nursing practice. The advanced nursing practice can use this theory of chronic sorrow to better care for those patients that have been affected by chronic sorrow. The theory has provided a definition and concepts needed to better understand chronic sorrow so that the individual experiencing it can be understood. According to Eakes et al., the professional healthcare provider should understand that chronic sorrow is commonly experienced by individuals regardless of age who has experienced significant loss or ongoing loss. Chronic sorrow can affect any individual, and the advanced practicing nurse should be aware of that when practicing. I will now talk about the implications the theory has for the advanced nursing practice, as well as get an advanced practice nurse to recognize chronic sorrow and provide those external management methods outlined in the theory of chronic sorrow. Interventions that demonstrate an empathetic presence or caring approach have been found to be most helpful for these patients. Being sensitive, caring, patient, compassionate, non-judgmental, respectful, and accessing coping skills should be done when having an encounter with an individual that is dealing with chronic sorrow. An example of how the theory can be used in the nursing practice will be expressed through a clinical scenario. Mr. J is a 79-year-old male that comes to the clinic for regular checkups and as needed when he's sick. On this particular visit, Mr. J is very sad and is just not like his usual self. Mr. J begins to state that his wife died about 2 years ago and he hasn't been the same since. He goes on to say that today is their anniversary and that's the reason why he's sad. He usually becomes sad on birthdays, anniversaries, and other special occasions. From the theory of chronic sorrow, the advanced practice nurse knows that chronic sorrow will continue as long as there is a disparity. Even though it's been 2 years, the disparity is still present and certain situations will trigger a period of sadness. To help Mr. J, the advanced practice nurse will provide external management methods outlined as effective by the theory of chronic sorrow. The advanced practice nurse will be empathetic, patient, compassionate, sensitive, caring, and assess those coping skills displayed by the patient. There may also be a referral to a support group. These interventions are within the scope of practice, and they have been found to be very beneficial in helping a patient affected by chronic sorrow. In conclusion, the theory of chronic sorrow is very important to the nursing profession as it provides knowledge and understanding of the concept. Chronic sorrow is very prevalent within the world, therefore it's very important to understand the concept. With this knowledge, the patients affected by chronic sorrow will be better understood and cared for. Even though studies have been conducted related to chronic sorrow, there is still more research needed to be done to further explore the concept and the individuals it affects.